At Health is Wealth, we believe aging should be empowered by wise choices, supported by smart habits, and fueled by good nutrition and balanced routines. Our goal is to guide seniors through their wellness journey with practical, doctor-minded advice and simple changes that make a big impact. From food recommendations to lifestyle habits, we're here to help you feel stronger and move better. Are you experiencing joint discomfort, stiffness in your knees, or weakness in your legs? Pause and listen. A recent clinical study followed thousands of adults over 50 and found dramatic reductions in joint pain from dietary changes using common foods from the fridge and in their kitchen. This information has been overlooked by many in mainstream health conversations. If you're ready to take control of your joint health, leave a smile emoji in the comments. What follows is evidence-informed nutrition guidance you can try at home. Is arthritis chronic? Arthritis is a chronic disease. The symptoms usually can be controlled, but for many people, the disease remains. Being told you have a condition that's not likely to disappear can be a shock at first, and the information may be hard to believe and accept. Daily treatment is necessary to keep symptoms under control. For example, doctors often advise people with arthritis to take medication and to rest and exercise daily, even when they feel well. Arthritis treatment may require changes in routine ways of living, such as scheduling time to exercise and rest. These changes can be difficult to accept. Some people try to ignore the fact that arthritis is chronic, and they avoid parts of their recommended treatment. Allowing arthritis to go untreated can result in additional damage to the body. One of the most common questions people with arthritis ask is there a special arthritis diet? While there's no miracle diet for arthritis, many foods can help fight inflammation and improve joint pain and other symptoms. For starters, a diet rich in whole foods, including fruits, vegetables, fish, nuts, and beans. But low in processed foods and saturated fat is not only great for overall health but can also help manage disease activity. If this advice sounds familiar, it's because these are the principles of the Mediterranean diet, which is frequently touted for its anti-inflammatory and disease-fighting powers. 1. Mediterranean diet studies confirm that eating foods commonly part of the Mediterranean diet has the following benefits: lower blood pressure, protect against chronic conditions, ranging from cancer to stroke, help arthritis by curbing inflammation, benefit your joints as well as your heart, leads to weight loss, which can lessen joint pain. Here are key foods from the Mediterranean diet and why they're so good for joint health. Find more information to manage pain with our pain resources. 2. Fish. How much? Health authorities like the American Heart Association and the Academy of Nutrition and Dietetics recommend 3 to 4 ounces of fish twice a week. Arthritis experts claim more is better. Why? Some types of fish are good sources of inflammation-fighting omega-3 fatty acids. One study found that those who had the highest consumption of omega-3s had lower levels of 2 inflammatory proteins: C-reactive protein, CRP, and interleukin-6. More recently, researchers have shown that taking fish oil supplements helps reduce joint swelling and pain, the duration of morning stiffness, and disease activity among people who have rheumatoid arthritis, raw. Best sources: salmon, tuna, sardines, herring, anchovies, scallops, and other cold water fish. Hate fish? Take a supplement. Studies show that taking 600 to 1,000 milligrams of fish oil daily eases joint stiffness, tenderness, pain, and swelling. 3. Nuts and hemp. Seeds. How much? Eat 1.5 ounces of nuts daily. 1 ounce is about a handful. Why? Multiple studies confirm the role of nuts in an anti-inflammatory diet, explains Jose M. Ordovez, Ph.D., University in Boston. One study found that over a 15-year period, men and women who consumed the most nuts had a 51% lower risk of dying from an inflammatory disease, like raw, compared with those who ate the fewest nuts. Another study found that subjects with lower levels of vitamin B6, found in most nuts, had higher levels of inflammatory markers. More good news. Nuts are jam-packed with inflammation-fighting monounsaturated fat. And though they're relatively high in fat and calories, studies show noshing on nuts promotes weight loss because their protein, fiber, and monounsaturated fats are satiating. Just keep in mind that more is not always better. Best sources: walnuts, pine nuts, pistachios, and almonds. 4. Fruits and vegetables. How much? Aim for 9 or more servings daily. 1 serving equals 1 cup of most veggies or fruit or 2 cups of raw leafy greens. Why? Fruits and vegetables are loaded with antioxidants. These potent chemicals act as the body's natural defense system, helping to neutralize unstable molecules called free radicals that can damage cells. Research has shown that anthocyanins found in cherries and other red and purple fruits like strawberries, raspberries, blueberries, and blackberries have an anti-inflammatory effect. More good news. Citrus fruits, like oranges, grapefruits, and limes, are rich in vitamin C. Research shows that getting the right amount of that vitamin aids in preventing inflammatory arthritis and maintaining healthy joints. Other research suggests that eating vitamin K-rich veggies like broccoli, spinach, lettuce, kale, and cabbage dramatically reduces inflammatory markers in the blood. Best sources. Colorful fruits and veggies. The darker or more brilliant the color, the more antioxidants it has. Good ones include blueberries, cherries, spinach, kale, and broccoli. 5. Olive oil. How much? 2 to 3 tablespoons daily. Why? Olive oil is loaded with heart-healthy fats, as well as oleocanthal, which has properties similar to nonsteroidal anti-inflammatory drugs, NSAIDs. Oleocanthal inhibits activity of COX enzymes, with a pharmacological action similar to ibuprofen, says Ordovez. Inhibiting these enzymes dampens the body's inflammatory processes and reduces pain sensitivity. Best sources. Extra virgin olive oil goes through less refining and processing, so it retains more nutrients than standard varieties. And it's not the only oil with health benefits. Avocado and safflower oils have shown cholesterol-lowering properties, while walnut oil has 10 times the omega-3s that olive oil has. 6. Beans. How much? About 1 cup, twice a week, or more. Why? Beans are loaded with fiber and phytonutrients, which help lower CRP, an indicator of inflammation found in the blood. At high levels, CRP could indicate anything from an infection to RA. In a study, scientists analyzed the nutrient content of 10 common bean varieties and identified a host of antioxidant and anti-inflammatory compounds. Beans are also an excellent and inexpensive source of protein and have about 15 grams per cup, which is important for muscle health. Best sources. Small red beans, red kidney beans, and pinto beans rank among the U.S. Department of Agriculture's top 4 antioxidant-containing foods. Wild blueberries take the number 2 spot. 7. Whole grains. How much? Eat a total of 6 ounces of grains per day, at least 3 of which should come from whole grains. 1 ounce of whole grain would be equal to 1/2 cup cooked brown rice or 1 slice of whole wheat bread. Why? Whole grains contain plenty of filling fiber, which can help you maintain a healthy weight. Some studies have also shown that fiber and fiber-rich foods can lower blood levels of CRP, an inflammatory marker. Best sources. Eat foods made with the entire grain kernel, like whole wheat flour, oatmeal, bulgur, brown rice, and quinoa. Some people may need to be careful about which whole grains they eat. Gluten, a protein found in wheat and other grains, has been linked to inflammation for people with celiac disease, CD, or gluten sensitivity. 8. Nightshade vegetables. Why? Nightshade vegetables, including eggplant, tomatoes, red bell peppers, and potatoes, are disease-fighting powerhouses that boast maximum nutrition for minimal calories. Why not? They also contain solanine, a chemical that has been branded the culprit in arthritis pain. There's no scientific evidence to suggest that nightshades trigger arthritis flares. Test it. Some experts believe these vegetables contain a potent nutrient mix that helps inhibit arthritis pain. However, many people do report symptom relief when they avoid nightshade vegetables. So, if you notice that your arthritis pain flares after eating them, consider eliminating all nightshade vegetables from your diet for a few weeks to see if it makes a difference. Then slowly add them back into your diet to see if symptoms worsen or stay the same. Now that we've learned about some of the healthy foods, let us now dive into some spices that are beneficial in reducing arthritis pain. Often, when prepping a meal, food is the primary focus and spices are an afterthought. But when following an anti-inflammatory diet, it's important not to overlook the benefits of certain spices to season your meals. In a study from the National Arthritis Foundation, people are often surprised at what a great anti-inflammatory source spices can be. But the more anti-inflammatory foods and spices patients with arthritis eat, the more they are tamping down on chronic inflammation. Anti-inflammatory spice basics. When you have arthritis, your joints and sometimes other parts of your body become inflamed, and many spices inhibit certain inflammatory pathways in the body. And although a dash of cinnamon may not seem like a lot, spices can pack a significant punch when you consume them throughout the day. If you do a sprinkle of cinnamon in oatmeal or a smoothie, have some ginger tea mid-morning, and something with pepper and garlic for lunch and dinner, it can certainly have an additive effect, explains Beth McDonald, a nutritionist at the Center for Health and Healing. Try to experiment with new recipes and incorporate a spice with an anti-inflammatory benefit with every meal. With that in mind, here are some anti-inflammatory spices to consider the next time you are in the kitchen. 9. Garlic. Garlic is a tasty addition to just about any savory dish. Like onions and leeks, it contains diallyl L-disulfide, an anti-inflammatory compound that limits the effects of pro-inflammatory cytokines. Therefore, garlic can help fight inflammation and may even help prevent cartilage damage from arthritis. Tip: opt for fresh garlic from the produce section of your market. Preservatives may be added to bottled garlic in processing, which may decrease some of its strength. 10. Turmeric. Curcumin is the active chemical in turmeric root. It blocks inflammatory cytokines and enzymes in two inflammatory pathways. Several human trials have shown an anti-inflammatory benefit, which can translate to reduced joint pain and swelling. The yellow spice is popular in curries and other Indian dishes. Tip: it is most effective when eaten with black pepper, which helps the body absorb it better. You can also add some into your yogurt too. Personal example: Eleanor's improvement. Eleanor, a 68-year-old grandmother from Dayton, Ohio, started adding turmeric into a cup of Greek yogurt for breakfast each day. Within a few weeks, she noticed improved stamina on stairs and less morning stiffness. Within 2 months, she was able to play longer with her grandchildren without needing frequent rests. If you are having any value from this video, I want you to type turmeric and yogurt for breakfast. Her routine became a simple, affordable foundation for rebuilding daily activity. 11. Ginger. Gingerol and shogal are the chemicals in ginger that block inflammation pathways in the body. Along with its anti-inflammatory properties, some studies have shown ginger can also reduce osteoarthritis symptoms, although other studies do not find such benefit. Tips: ginger is a versatile spice and can go in both sweet and savory dishes. It's best to use it in its fresh form. A great way to add ginger to your diet is to boil it into a tea. Put a 1 to 2 inch piece of fresh ginger root in boiling water for 30 to 60 minutes. Ginger is also great for seasoning fish, meat, and chicken. 12. Cinnamon. Cinnamon contains cinnamaldehyde and cinnamic acid, both of which have antioxidant properties that help inhibit cell damage caused by free radicals. However, Studies say more research is needed to make formal recommendations about its use. Tip: cinnamon is delicious mixed with oatmeal or added to smoothies, yogurt, but it's not strong enough on its own to offer a therapeutic effect. Used in combination with other foods and spices, it may offer a cumulative anti-inflammatory effect over the course of the day. 13. Cayenne pepper. Chili peppers contain natural compounds called capsaicinoids, which have anti-inflammatory properties. Cayenne and other dried chilies spice up sauces, marinades, and rubs. It also serves as a source of fiber. Tip: chilies can be hot, so start with just a dash or two. If you've never tried cayenne pepper, type in the comment, cayenne pepper. General tips for using spices. When trying a new spice, start small and add more after you've taste-tested your dish. Anywhere from a half teaspoon to a full teaspoon is generally a good place to start for most spices, except cayenne. Start with a 1/4 of a teaspoon or less. A good rule of thumb with spices is, fresh is best, but experts say bottled spices can pack a punch too. Spices are already dehydrated, so the antioxidants are concentrated in a small, powerful amount, is great. Remember the wide variety of foods you can spice up. They are wonderful in rubs, marinades, and sauces, on steamed or roasted vegetables, mixed into pasta, potatoes, rice, couscous, and quinoa, and in soups and stews. Thanks for watching, and don't forget to subscribe, like, and share so more seniors and people living with arthritis will benefit from this educational information. Health is wealth.